Welcome to selfdiscoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to Your Health is Your Choice right here on selfdiscoverywisdom.com. I am your host, Sarah Troy, and my wonderful guest today is Dr. Sophia Yen. And she says anyone with a uterus needs to stop sucking it up. And I completely agree. We don't want to be told that anymore. She says if you have painful periods or menopause symptoms, please see a doctor, Dr. Sophia Yen. She will cover how estrogen replacement therapy or menopause hormone therapy, MHT, can benefit anyone in menopause or age who are born XX. Indications of MHT, making periods optionals, a life hack, and a way to decrease ovarian, endometrial, and colorectal cancer, and risk of anemia, and all the birth control options. She was given a talk with a bunch of doctors, and the question came up: why don't women take birth control? One of the top reasons, they don't have it on hand. So my friend and I started Pandia Health to make sure no one runs out of birth control on our watch. They ran ads, free birth control delivery, and 60% of the respondents did not have a prescription. So they added telemedicine. And then she hit menopause. And all her friends said, menopause. I said, yes, yes, I will find the best treatment out there for you. And she did. And now Panda Health has been going for 14 years, and it can help people for 14 years their entire life. So from that first period right up to the end of it. And the only woman founded and led, and the only doctor founded and led, and the only mums founded and led birth control delivery company, they're building an online health brand women can trust. They are in the States only, folks. However, if you're so inspired by this and you want to go down the licensing and affiliation platform, she's open to definitely discussing with you in your country. But this is for women and men who love women because they go through it in a different way. I had a wonderful show on many years ago about the 4 seasons of a period. And like each week is like a season. And there's the week leading up to your period where you're lethargic, and then the week of the period you just don't want to be bothered with anything. Then as you come out, you've got enthusiasm, and that, second week, let's go and do it. And if you understand what each week represents, then you don't put pressures on a woman before that they can't deliver because, periods are changing the way we feel. We're bloated, we're tired, may change the way we think. And, birth control is one that can really help with that, as well as stopping pregnancy. But you've also got another birth control thing where you don't have to have a period at all. So before we hit menopause, let's hear that big period. Welcome to the show, hun.
Thank you so much for that amazing introduction. And I'm so excited to be here today and share my expertise, experience, and passion for improving women's lives.
And, yeah, you have the rare cases where women don't have periods or, something happens, but just every woman goes through the period. Some people start it very early. I was 13. I know some people have started it as early as 8. Some people 16. You never know when it's going to come or when it's going to stop. I had menopause early, I had it at 50, where I know other people, it's 60. So, each to our own. We have no dictation on what and when and how, but how to manage it and how to prevent an unwanted pregnancy, or even as the birth control pill was kind of designed in the first place, was to help manage going through the period as well, right? So let's discuss birth control, my dear.
I guess the first thing with birth control that I'd love people to know is that there are 40 different birth control pills, 8 different progesterones. And if you don't like one particular birth control pill, don't be like, oh, this method doesn't work for me at all.
Hmm.
Simply, this pill at this dosage of this progesterone doesn't work for me. So note the progesterone and tell your physician, I don't like this progesterone. And it is possible that the progesterone level can go up or down from the one that you're at, but at the very least, there's 7 other
Mm.
progesterones out there. And as a woman of color, I realized going through medical school, and if you all don't already know, most of medicine is based on the 70-kilo white male, and certainly not for birth control.
I'd like to see
But
them go for a period. Then you see
yes.
some changes.
No, for birth control, a Caucasian female. And so, speaking to my fellow doctors of Asian, Black, and Latina descent, we're like, oh, yeah, that thing that we're teaching all the medical students across the United
Mm.
States, this is the first birth control pill you should try everybody on. And if it doesn't work, then figure it out after that. And
Yeah.
so, most doctors are taught this first pill, but this first pill does not work for our people. And after personally prescribing 3,000 birth control prescriptions in 2 years and seeing the side effects. I took all of the birth control pills, ranked them. Most likely make you bleed, least likely make you bleed. Most likely give you acne, least likely give you acne. Most likely to give you munchies, least likely give you munchies. And took the one we were teaching everyone across the nation to prescribe in the United States for women and fixed it for the side effect that we were seeing in people of Asian, Black, and Latino descent. And with that proprietary algorithm, we see 82% retention at a year for newbies to the birth control pill
Wow.
versus the standard 30 to
Wow.
55%. And part of it is also our delivery, but the other part of it is this algorithm. And then at 10 weeks, we check in for free and we're like, are you having breakthrough bleeding? Are you having acne? Are you having munchies? And if so, our doctors know what to bump up, what to bump down, and
Mhm.
suggest the next birth control pill. But we have I'd say 95% happiness rate with the
Wow.
first pill that we suggest, and then we tweak with the next 5% at the 10-week follow-up. And right now we're using race as a proxy for genetics, but as you know, America and everywhere is becoming the mixing pot.
Yes, yes.
So the future is genetics. And with more
Mm.
people doing 23andMe, DNA ancestry, if you give us your DNA, then we are running a machine learning model where we're throwing in the DNA, throwing in the pill that you ended up with. And so then our model can then say, oh, you have these 3, 4, 5 genes. The woman that had similar did well on this pill. Let us
Mm.
recommend this pill for you. And so that is the future for Pandia Health with both respect to birth control, but also menopause, and then any health condition that we take on.
Bravo for that. Bravo. Using the technology. I have mixed race children. They're half Chinese, half English.
Oh,
So, it's what are their genetics? Unless we, look at it, we don't know. I was terrible with periods. I was one of those people that used to pass out,
yeah.
and the cramps and everything else. And so I always had to take the whatever the lowest dose was, and I couldn't take it for too long. And then, went for the coil and had
Uh-huh.
a tropic pregnancy with that. And,
Oh,
just
no.
like one nightmare after the other. And what we do see for so many people, we see so many unwanted pregnancies, which is unnecessary. Right
Mhm.
now, we know that the guy, ain't so happy about condoms. Well, I'm sorry if you want the fun, it's you've got to have you got to have the rubber, and if
Yes.
or you got to know that she's on the birth control pill, because Planned Parenthood should be there because we
Yeah.
we don't want to see a child being unwanted. Um, I have a book. Sorry, I'm going to plug this, but it's about that, and I'd like you to write about it in the next book. But it's
Yeah.
Our Forgotten Children, and it's
Mhm.
really the raising of our children and how we're letting them down with the systems. And part of the system is that people are having children that they weren't ready for, or they didn't want. They're financially not equipped, emotionally not equipped, and so we really do need to push more the taking of the pill. One of the big problems with, certainly my generation, which I'm hoping we don't see anymore, and sounds like we don't, is all the side effects. So finding the right pill, going
Yes.
through all the other problems. And if people know, hey, I could have a pill that's designed for my genetics, I could
Yes.
have a pill that isn't going to make me feel like this or like that, or I'm not going to break out and all of
Yes.
that, then they're more likely to take it. Right.
Exactly.
And especially if we
Yeah.
can keep the cost down. And I think, quite honestly, in government, though I'm sure it's going to be a fight for a long time. Menstrual pads, or anything to do with a menstrual cycle that you have to take, and the pill, even
Yes.
condoms, should be free.
Yes. And in the United States, thanks to Obama Biden and the
Mm,
Affordable Care Act, any FDA approved birth control method, the pill, the patch, the ring, the IUD, the implant, the shot, emergency contraception, is available with no copay, no deductible, aka free, if you have insurance in the United States.
right.
And so if you're employed and have insurance, or if you're on Medicaid or Medicare, they're not relevant to Medicare because that's for the older, but the Medicaid, low income. And so there is a gap that don't have insurance in the
Mm,
middle. We're trying with the Affordable Care Act to make it affordable, but those who have insurance, no copay, no deductible, aka free. And then I absolutely support you and agree with you that wherever there is free toilet paper, there should be
hmm.
free menstrual products. And
Yes.
if you don't, then you're just sexist and you
Yeah.
don't believe in those of us with uterized dignity.
Hey, hang
So,
on, you wouldn't be here if it wasn't for us. So,
yes,
why are
yes,
we having to pay every month physically
yes,
and
yes,
financially, right?
yes,
So that we can produce another human being.
yes.
You
No,
just
my
provided the
father,
seed. We did all the other work.
exactly. I wear this uterus necklace. I'm one of the few CEOs you will see with a uterus necklace, and I'm going to reach over and grab my condom bag. And
I love it.
sometimes a beaver ring, but not today. But the uterus reminds me that we all came from the womb.
Hmm.
Respect the womb. And
Hmm.
I love my feminist father in that he's like, we all came from the womb. We are
Mm.
the bearer of life. Without
Yes.
us, there is no life.
Hmm.
And you owe us. And that's what I make clear to my children. You owe me because I carried you for 9 months and then I breastfed you. But at least give us our dignity, give us our
Yeah.
menstrual
Yes.
product, give us the ability to control when and how many children we have. And it's
Mm.
a family decision and affects the entire family as well. It's not
Yes.
just on us, and we shouldn't bear the burden. And it is a societal good when people decide how many and when they have their children. But back to birth control, wanted
No,
to
but
make sure.
I'm not just before you get there. I do agree with that
Yes.
completely because I think that's something we need to address. My daughter has two, and she wants a third. I have another daughter who will never have children. She's kind of the auntie Mame, right? She'll take them to museums and this and art galleries and all of that. And
Little
then my
one.
son is getting married this year, and he turns 40 this year, and they're going to try for a child because
Wonderful.
his fiance actually has going to be 10 this year when they get
Uh,
married. So there will be a 10-year-old, stepdaughter, and then they're going to go for a baby. We're seeing more and more. I mean, my daughter had hers, what, at 32 and 34, right? And we're seeing more and more, people having a career, having a life, and
yeah,
then deciding to have a family. And we're also seeing many, many people deciding not to have a family.
yeah.
And when we look at overpopulation, we've got to understand baby boomers like me, right? As we die out, um, the millennials are not having as many children as before. And so
Mhm.
we're going to see that population go. And we're also going to see at the same time, we are going to have to be more reliant on technologies to do certain work because we're not going to have the manpower, right? So every child is a gift. And what we need to look at is, are we there not just to support the woman through pregnancy when she chooses to have it, the birthing, the support afterwards, but are we there also going to support families instead of taking children away from families and putting them into foster homes where 9 times out of 10 it's a horror story of
Mhm.
what they go through. Uh,
Mhm.
are we going to invest in the families to keep them together, to support them, or if a mother is abandoned, husband abandoned or partner abandons, that she's not just left now trying to struggle to raise that child on her own. So I think it's really important that we do just throw that in there because motherhood is an enormous responsibility from the moment you conceive to the dying day, right?
Yes. Yes. No, you are mother until your last breath. If you
Yeah,
give birth, there's that connection
yes.
forever.
I say, I don't care how big and tall you are. You're still my babies.
Yes, exactly.
Even though I'm holding your children, my grandchildren, you're still my babies. And that's something,
I love it.
becoming a mother, I think, is something that a father, I think, is because we're seeing fathers more at the birthing and seeing fathers more on hands, diaper changing, getting up at the
Yes.
night feeding and doing more as opposed to the woman takes care of it all. We're
Yes.
seeing more of that participation from fathers, which is wonderful. But it still goes to the fact that, as you said, there's that huge gap that don't have Medicare, that don't have any medical support whatsoever. Why can't we have clinics for people like
Yes.
that, that are for the less financially fortunate, that
Yes.
they can go in and get this pill because they're generally the ones having the children that they are not ready for, that
Yes.
end up in the foster home. So
Yes.
it shouldn't be just that you have a medical insurance and you're covered. How about the people that really need it, that maybe there is a clinic or they can just, go on your platform somehow.
Yes.
There's got to be that gap.
Well, for those in the US, if they don't know, there's definitely Medicaid for the very low income, but it's the in between, the gap people, and the
Mm,
gap people at Starbucks or Walmart or
yeah.
other low paying kind. Starbucks is actually quite good, but Walmart is known as the number one employer of people on government insurance because they purposely underemploy so that the government has to pick it up. But then
Mm,
they give resources to sign up for the government insurance. But know that there's Title 10 clinics in the United States. It's Title X, but some conservative states have rejected the funding, but it is specifically for family planning. It is a federal program. And so in the US, we have those, I think technically in all 50 states, but whether your state rejected it is on your state, unfortunately. And so
and for
there,
you to stand up against it in your state because
yes,
no bald-headed round man has the right to tell you what to do with your body. So,
should
yes,
not,
no,
should not have the
has no
right.
right.
Yes.
Religious or
And
anything has no right, full stop.
yes, yes. And so make sure you vote and make sure you ask your elected officials where they stand on Title 10
Mm,
funds and Medicaid funds for
mm,
your state, because you'll see the more conservatives are rejecting both the birth control and funding for low income Medicaid patients as well. But know that that exists. And then if
mm.
not, Pandia Health is only $30 once a year with unlimited follow-up questions with a physician
Wow.
about anything birth control, but only
Wow.
birth control because you only pay $30.
Right, exactly.
And
Exactly.
then the medications are roughly 3 packs for $55. So if you don't have insurance, then the cash option is there. There is a lower price pill. However, it's the one that's great if you're a Caucasian female that wants to
Mm,
bleed every month. But if not, then I would go with the other pill. And, at $55 for 90 days,
yeah,
that's then,
yeah,
75 cents a day.
yeah,
So maybe you could set that aside if this is a priority for you and your
right.
family.
It's good to know. That's really good to know because as you said, like in your written piece there, people didn't know. They don't know the right pill. They don't know where to get it.
Yes,
If some people are just uncomfortable talking to a doctor, all right,
yes,
and it's like now, getting this message out there that this is your option, right? You have
yes,
not been left behind. Pandia
yes,
Health is there to lead the way and show you the way, which is really, really important. So let's talk about periods.
yes. So, trying to get pregnant back in 2006, I realized the only reason those of us with uteri bleed every month of reproductive age is because we build that lining and we're like, embryo? Oh, no embryo, bleed. And then we
Yes.
build it again. Embryo? Oh, no embryo, bleed. And we do this on average in the United States from age 12 until 50. 52 is the
Hmm.
average age of menopause. And so, although there are variations, there are kind of standards. And the
Hmm.
standard is most people get their period at 12 plus or minus 4 years. But
Hmm.
as you mentioned. And then most people get menopause at 52, plus or minus 5 years on each side. And you can start to get the premenopausal symptoms 10 years before menopause. But
Mm.
why are we building and
Mm.
sloughing, and popping out an egg every single month from age 12 to 50 if we're only going to pop out 2 children?
Right.
All those periods, other ones are unnecessary.
Hmm.
And every time you build up that lining, it can mutate and turn into endometrial/uterine
Mm.
cancer.
Hmm.
Every time you pop out an egg, and we don't know if it's the popping, the healing, we think it has something to do with the tube, you risk ovarian cancer. And so,
Mm.
one way to test your physician to see if they know their stuff or your healthcare provider is what can I do to decrease my risk of ovarian cancer if I'm in the reproductive age group? And they should answer go on the birth control pill, patch, or ring for 5 years, and that will decrease your risk of ovarian cancer by 50%. There
Wow.
is no other way to decrease your risk of ovarian cancer other than taking out your ovaries, which we do not recommend unless you're postmenopausal and then you take them out because you don't really need them and they're a risk for ovarian cancer.
Right.
But only if you're already in there, don't just do a surgery just for that.
Right.
But this is a way to decrease because by turning off the popping of the egg for 5 years, you decrease your risk of ovarian cancer by 50%.
So
And
what
so
happens in the other 5 years if you're young and you've still got years to go before menopause?
yes. So the longer you're on it, we believe the greater the protection against ovarian cancer.
Hmm.
Because I mentioned every time you build that lining, it can mutate, and that's
Yeah.
endometrial uterine cancer. Every time you pop the egg, it can have ovarian cancer. And so at least 5 years to decrease your risk
So
of
you can
ovarian.
stay on it longer.
Absolutely. And so
Right.
that's a myth I'd love to address. People are like, does birth control make me infertile? And my
Hmm.
joke is, while you're on it, that's why you're taking it.
Yes. Yes.
But if you've studied drugs and pharmacology, in 2 to 3 half-lives, it is out of your system. And so, for those who've been on the birth control pill before, and you can see behind me that there are 3 weeks of one color and 1 week of the other. And that 1 week is placebo, sugar, placeholder. Sometimes they put iron in it. But by day 2 or 3, the hormones have fallen, are out of your system, and that triggers a withdrawal bleed. And so by day 2 or 3, it's out of your system. But if you want to be really technically anal, you could wait a week or two and those hormones are out of your body. And so that applies to the pill, the patch, the ring, but
Hmm.
also the IUD, the implant, IUD with hormone implant. As you take it out, it's out of your body, the hormones, within 3 days, if not within a week, within 2 weeks. And so it does not make you infertile. But then people say, oh, I was on the pill and then I came off and I had a hard time getting pregnant. It must have been the pill. Well, the
Right.
research shows that if you have 100 people on the pill, 100 people not on the pill, wait 20 years for both of them and ask them all to get pregnant, both groups have 10% that cannot have a difficult time getting pregnant.
Hmm.
And what it is 1 in 10 people that were born with a uterus will develop something called polycystic ovarian syndrome, PCOS. And what that is with extra weight gain, with insulin resistance, the ovary doesn't pop out an egg and cysts start to accumulate. And if you can't pop out an egg, you can't get pregnant. But
Mm.
the point is that it's 10% of each. And so it's 10% of people on the pill can't get pregnant, but 10% of people who
Right.
didn't take the pill can't get pregnant either. So it's not the pill, it's the polycystic ovarian syndrome.
And of course, in my day, it was that they didn't want you to be on the pill more than 5 years because some sort of side effects, which of course is now being demythed.
Yes, yes. And also back in the day, they started, this is the only medication that they started at the highest dose possible and worked their way down. And I was
Hmm.
like, because they want to torture women, but really because getting pregnancy is a serious bad
Yes.
side effect that you don't want. But know that the original pills were 110 micrograms of estrogen. And
Mm.
now the standard is 30. So that's
Mm.
about 1/4 of the original dose. And then there is a 20 microgram dose, and I'm an adolescent medicine specialist. So I specialize in teenagers. I have concern for bone density. You do not want the lowest estrogen possible when you start. You want at least 30 micrograms of estrogen until 30 years old. And then once you're 30 and above, it's fine. But
Mm.
if you have too little estrogen, then you don't build the bone density that you will need later in life. So that's
Mm.
yet another tip. Whenever I give this talk, women will take their pill and they'll be like, "Ooh, I'm on 20 micrograms or I'm on 10 micrograms." And it's because you asked your doctor, please give me the lowest
Mm.
estrogen. It has the lowest risk and lowest side effects. But actually, the lower estrogen is not good for you if you're under the age of 30 and
Mm.
sometimes results in greater breakthrough bleeding.
Interesting, very interesting. So much has changed since my day, which, and, there was just, it also was not something that we talked about. Even if you went to your doctor, it was kind of very clinical. And so
Yes.
we just didn't have that information. Of course, we didn't have internet back then, folks.
Yeah.
We actually had to go and make appointments and talk to people and generally male doctors.
Yes.
And it was just very dry. So, I had a problem. I think they gave me the high one and I had side reactions to it and I was better. But I'm like that with all medicine. I'm better
Yeah.
on the lower dosage. My body doesn't like high dosages of stuff.
Yeah.
So it's just the way that I'm designed. But I think that you need to have someone that hears you. Right. So here you've got for $30 a year, someone who hears you. That one's not working for you. Okay, fine. Now let's look at maybe your genetics or let's look at this and that and which one is better for you. Because this is a subject for so long that women have just been left out in the cold, flapping in the wind, hoping that the doctor, who's a male and doesn't really want to talk about it, gives you the right prescription. And then
Yes.
also puts the fear of God into you as well.
It's really also just that you have to realize physicians have so much to know. And over time, there's just more and more and more to know. And so that's why, being our company, we only do birth control. We
Mm,
only do acne. We only do menopause. We're doing stuff that your primary care doctor has not had the time to
right.
specialize in.
It's the
I
same with
wrote
nutrition, right?
Yes. So I wrote 3,000 birth control prescriptions. Your
Mm,
physician writes five a week,
yeah.
maybe. And they have all these other things on their mind, but all I've been doing is birth control. And I'm an academic physician. I went to MIT, UCSF, clinical associate professor at Stanford, masters of public health at Berkeley. So I'm obsessed with improving and better and
Mm,
writing a paper and finding the science. Whereas your doctor's in their office and they're told by their employer, you have to see a patient every 15 minutes. But all
yeah.
I do is
Oh no,
birth control.
that's a luxury if it's 15 minutes. I mean, here in Canada, we have millions of people without doctors. I haven't had one for 5.5 years. So I
Oh,
have to call a doctor and I'm allowed one question in 3 minutes. That's it.
no,
Uh,
that's horrifying.
I know we're
Have
really bad on doctors. It's this the cost to running a clinic is
yeah,
high because our property is high. And all the other expenses, and they're trying to entice new doctors. And of course, through COVID, I remember interviewing a doctor saying, "You're going to lose a lot of people in the medical profession. They'll be
yes,
burnt out and not want to do it anymore." And that's also been the case. And many
absolutely.
of them have gone into private practice.
Yes.
So many. I know here in BC, just in our province, there's a million people looking
Wow.
for doctors. So it's
Wow.
really hard. So having something like what you're doing, which I would like to see more of, we put all the emphasis on the doctors to know everything. And the things when it comes to nutrition or vitamins or preventative
Yes.
medicine, they're not trained. So
Yeah.
having specialists like yourself, this
Yes.
is your department. This is
Yes.
where you throw all your expertise in. If we can have
Yes.
another doctor that works with doctors that, has all the information, so is covered by Medicare or covered by
Yes.
medical thing,
Yes.
where they taught nutrition, somebody else talks something else. And
Yes.
in that way, instead of it being specialists and it's like a 2 or 3 year wait to see a specialist,
Yes.
right?
Yes.
In having it that it's more mainstream and that people more accessible, I think
Yes.
what we need to kind of break up the medicine in a
Yes.
way that you're a specialist in this field. We need
Mm-hmm.
specialists in that field, but not
Mm-hmm.
the specialist that we need a doctor and then have to wait years to go and see.
Yes. Yes.
It's the everyday specialists of everyday maintenance or everyday problems,
Yes.
right?
Yes.
But I do know, I mean, I have a doctor that I've interviewed a few times, Timothy Teal, ear, nose, and throat doctor, and he started talking diet with his people. The reason why you're getting this problem, this and this inflammation is the food, cut this out, cut that out. And he
Yes.
went more holistic, and he's been blacklisted for it.
Oh
So,
no.
and there's a many doctors that get blacklisted because medicine on both sides of the coins has become very much a financial institution, a business, rather than a caring one. And so I think the more and more people like you that decide to step up, I care. This is my driving force. This is my expertise. And it's still medical and it's still
Yes.
covered. Uh,
Yes.
and the more and more we see that, the more and more we're empowering the doctors to be
Yeah.
actually able to treat a patient
Yeah.
in a way that, is more holistic in many ways, with which right now it's all numbers driven. That's the reason why he was blacklisted. He wasn't making enough money on operations and drugs.
Yes. No, I totally hear that. And, to me, that's why it's really important in the United States is we see startups
Yes.
that if it's a health startup, you want a doctor founder,
Yes.
ideally a doctor CEO or a doctor in the key group who's respected,
Yes.
because we see the push between the MBA and the
Mm.
physician. And as a physician, I've taken the oath, do no harm. I
Hmm.
cannot say that the same of the MBA founders out there. And they're good people and all, but sometimes they push for things for the sake of money. And
Hmm.
as a physician, I'm like, that's not cost-effective medicine. That is
Yes.
not standard of care. And I'm seeing for-profit companies offer, testing for STIs, testing for blood tests. And certainly you can charge people $200 to $300 for all these blood tests that they may never have needed.
Yeah.
And don't charge that to insurance and don't make me pay for it as a taxpayer,
Yeah.
that kind of thing. Or they're selling you a anti-nausea drug to go with this treatment when only 1 in 100 people will need that nausea
Yeah.
drug. And I was like, what is the ethics of pushing
Hmm.
this? Or what if you're billing my insurance and my insurance hasn't put a limit on that nausea drug, but now they have to put a limit because you are trying to just make extra money and bill extra things. So at Pandia Health, we try to, practice cost-effective, evidence-based medicine. And certainly, just so everyone knows, placebo works 30% of the time
Hmm.
for anything, for
Hmm.
mental health, not for
Yeah.
antibiotic infection, but
Right.
for like
Yes.
mental health and for odd menopause symptoms. And so we will never be selling you placebo. It has to beat placebo. And so you want a randomized clinical trial against placebo, against the standard of care, and whatever it is they're suggesting should beat it or at least meet it, and then look at the cost. And so sometimes the supplement, which is not in the United States, I don't know, in Canada, FDA regulated. They
Hmm.
have tested supplements that said 100 milligrams St. John's wort. And within the same bottle, I could know if it was between batches, maybe, but same bottle, you'll find 0 milligrams
Yes.
and 1,000 milligrams because no one's testing it, no one's
Right.
controlling it. And certainly there are companies that are trying to be reputable, but just know that these are not FDA regulated, not FDA tested. And so for menopause, we are doing the medical treatment of menopause. So bioidentical, but not compounded. Compounded, just so you all know, is a way to make more money. If I
Hmm.
compound something, I can charge more because it took more labor and I'm like customizing it to you, but you really don't need it that customized for acne, for menopausal hormones, etc. And that the current standard for menopause treatment is no tests and certainly not the Dutch
Mm.
urine dried spot test that's out there. So ladies, please, I know you're desperate for care, but that is not the standard of care. As a scientist, I absolutely do feel in the future it will be about drawing blood, or I
Mm.
have a friend who has a urine test that's like a pregnancy test, but
Yes.
not a dry urine test that you send in somewhere, that kind
Mm.
of thing. It must be validated and shown to consistently produce the same results compared to the gold standard. That will be the future. But for now, no tests are necessary. We just treat to your symptoms, which I don't like because it's very subjective.
Mm.
But know that there's bioidentical estrogen, bioidentical progesterone. This is different from the original Women's Health Initiative, which was the study that took down all of estrogen replacement therapy, took us back 20 years because there was a slight increased risk of breast cancer. It went from 4 out of 1,000 to 5 out of 1,000. And they're like, oh my God, it's a 25% increase. But it was 1 out of 1,000 extra breast cancer, but it decreased your risk of cardiac badness, bone badness, and a little bit of other things as well. And again, that was conjugated equine estrogen, not the bioidentical estrogen that patches that we're recommending now, which has decreased risk of blood clots and cholesterol badness. And then there has, to my knowledge, not been a single case of breast cancer associated with bioidentical estrogen and with no increased risk with bioidentical progesterone.
And the thing about cancer is that we've all got something systemic in our genes somewhere, right? I come from a family of cancer, but that doesn't mean automatically I'm going to get it. However, it could mean that it's laying there dormant, waiting for something to happen. And I think very often it's an 80% emotional disease, trauma, something happening that triggers the disease. Um, and 20% environmental, what are you putting in your body, what's around your body, on your body, that can cause it. And I think that, we love to, immediately blame, their fault, their fault, their fault. But, there's three fingers pointing back at us. Our accountability, did we do the research? What are the choices? If you have a family of history of breast cancer, maybe you do want to definitely question what you really need to need because you know that you're a higher risk. And so,
Yeah.
yes, be concerned, ask the questions, but don't get caught up in the hysteria out there. That's
Yes.
the important thing. You are unique, even though it might be quite common under your practice, but you are unique, each person, as to what you need. And I love the fact that you can customize to the ethnic groups. And as you said, mixed groups, which
Yeah.
ethnicity is coming through more. And the more that we can actually give you that information, the more that you're actually able to give us something that actually is for us. The same thing for menopause as for birth control. Is it based on the ethnicity of ours as well for menopause?
I would say because menopause pretty much has like one treatment. So there isn't the 40 different pills, there
Mm,
isn't the 8 different progesterones, and there are some other ones, but the gold standard is bioidentical estrogen. And so the good news is on the progesterone side, it's micronized progesterone, and therefore we feel a much lower risk, if any, of breast cancer with that. And so there aren't 8 different progesterones.
mm,
When we say 8 different progesterones in birth control, they're actually synthetic progesterones and they have all these different traits and qualities, but we're not seeing that with the micronized progesterone. And the other thing I've learned going into menopause, because my focus was originally adolescence and preventing unplanned pregnancy, is that the menopause therapy, though I like to call it replacement therapy because I really do think your body takes it away and we
mm,
put it back.
mhm.
But they want to say, no, it's just therapy for your menopause symptoms. But I really do think it's replacement for what your body has taken away. That I'm sorry, I lost my train of thought because menopause, I will blame it on that. But um, so just that know that there is just pretty much 2 drugs that we would recommend, not so many different variation on it. Oh, the what I did learn is that birth control is 200 times the strength of menopause replacement therapy. So
Mm,
the risk is 1/200th of that of birth
right.
control. And
Mm,
so and then even if you have a family history of breast cancer, as you mentioned, it doesn't mean you'll get breast cancer, and
mhm,
it's fine to be on hormone replacement therapy. Though if you personally had breast cancer, then you need to check with your oncologist
mm,
because if it was estrogen sensitive, then we would not want to give systemic estrogen.
right.
But also know that there's a difference between local estrogen. So you can put vaginal cream in your vagina area for vagina symptoms and recurrent urinary tract infections that is not systemic. And that
Mm.
should be fine for breast cancer. Um, so that even if you had breast cancer, you could take care of genital urinary symptoms with just local estrogen.
Would you like to see this kind of be a part of the school, like middle school, or educating girls especially, and of what to expect, what their options are? I mean,
Yeah.
a lot of people put their daughters on the pill early because of bad periods. That's kind of how it was originated for. But also we're seeing a lot of kids nowadays being promiscuous far too early in life, and we don't want to see, that teenage pregnancy.
Yeah.
Um, so would you like to see this kind of being part of the curriculum in school, the education? Not only the sex education, included in the sex education, but
Yeah.
the pill, what options they have, how they can do it, and then even talk about the menopause down the road, and that when they get there, this is what they can do. Because who's talking to them about it? Mothers? Half the time, the mothers don't know.
Yes.
I
Yeah.
didn't know all the other options. I had to rely on my daughters to go to the doctors to get the information, right?
And
And so,
sometimes the doctors don't know.
yeah,
So here's
exactly.
another quiz for your doctors and providers out there. Ask them to name the most effective birth control methods that they can provide you down to the least effective. And only because I love birth control that I know that the implant beats vasectomy. And that blows my mind
Yeah.
because we as Americans look up to you as Canadians because of your national health care and whatnot. And I heard that you guys didn't have the implant until recently because it had been out, it had been tested in Canada in
We're
order to
we're
be,
slow to adopt. We are. Yeah,
yeah,
yeah.
and you guys wanted new tests, and the drug
Mm,
company's like, I don't want to do new tests. We already know it works. And so anyway, you guys finally got it. But most people don't know that the implant beats vasectomy. And then comes the hormonal IUD, which beats tubal ligation. That two hormonal methods could beat the surgical permanent gold standard blows my mind. And so that's a way to check if even your physician knows that.
yeah.
So we need that education in the medical schools. We need that
Mm,
education in the residency. And specifically for menopause, I believe the statistic is like only 60% of OB-GYN programs teach anything about menopause. And even then, maybe 1 to 3 hours or something.
mm.
Back when I graduated medical school, which was, 20 some odd years ago in 97, we were just taught this is the treatment for menopause. Ready? Put your hand on her shoulder and say, this will pass.
Oh my God.
And
How
now
condescending.
that wasn't, I mean, it was, we don't know, we don't, suck it up. That's the way it
Yeah.
is. And
Mm,
I assume menopause will it technically is the day of your last period, but we can't diagnose it until 12 months after your last period. So for this whole time, you're like, is it done yet? Is it going to come? Is
yes.
it going to visit me again? Right.
Yeah.
It's just in waiting and stress anyway. And, but I thought it was a day, maybe 3 weeks, but now we're learning on average menopause hot flashes average 7 years. So that means there are people who have 5 years, 3 years, people that have 12 years on average 7 years. Would you go up to a man and be like, yeah, good luck with that,
Yeah.
suck it up for
Suck
seven
it up for
years
7 years. Yeah. Believe me, they'll
No.
be pouring all the money into the science to find a way, right?
Yes, but we
Absolutely.
as women are like, okay, yes. And I, as a feminist, I can do anything you can do without a uterus bleeding. But as a
Hmm.
doctor who believes in drugs and science, why? And so
Exactly.
know that, if you're bleeding every month and you're not trying to make a baby, you can make hashtag periods optional. Go to pandiahealth.com/periods optional. At the bottom is my TEDx talk on the science and safety of not bleeding every single month, and know that you do it using the pill, the patch, the ring, the hormonal IUD, the implant, the shot. But with the pill, there's 40 different pills, so it's a lot easier to find one, but you have to take a pill every day. So it's a discussion. And then with menopause, that on average 7 years. So I say, what I love by another physician, she said, you don't get a medal for white knuckling it to see how long you can go before you beg someone for menopause treatment. All you will have gotten is 5 years of sucking it up. So as soon as you have menopause, go see a menopause specialist and get that taken care of, because without estrogen, our heart is at risk because the cholesterol goes up. And then the thing that I noticed when I hit menopause is my waist disappeared because the estrogen, without it, redistributes the fat into your waist. And I was like, not only are you trying to kill me with high cholesterol, but you're ruining my skirts and my figure and my
Yes.
mental and my self-esteem, right?
Yeah.
And my skirts are tight. I was like, oh my goodness, I'm gonna have to throw away all my skirts. And also that visceral fat is more dangerous than subcutaneous fat. And I'm like, oh, so much negative badness. And then when I went on the bioidentical patches, the estrogen replacement, the waist came back. I was like, oh,
Yeah.
goodness. And then the cholesterol, because doctors who aren't thinking menopause will spend, they've shown, actually a study just came out of the UK that I think it takes on average 7 to 10 doctor's visits. And if it takes you forever to see your doctor, seven to
Yeah.
10 doctor's visits
Yeah.
before you get the menopause diagnosis. And so many women have been sent down this cardiac workup for palpitations, or I was given a statin for my high cholesterol. And certainly statins are a great thing, But it would have been interesting to start the hormone replacement therapy, see what that did
Mhm.
before we threw on the statins. And then it's good for your bone, osteoporosis. If you have any family history of osteoporosis, that there's only 4 technical indications for hormone therapy currently. One is at risk for osteoporosis, family history of osteoporosis, genital urinary symptoms. So, as I like to say, sandpaper vagina, dry and
Mhm.
painful sex, recurrent urinary tract infections, night sweats, and hot flashes. Not the cardiac, not prevention of dementia, but we know that it's good for the heart. And research has started to show that if you have ApoE4, which is the bad gene for dementia, that if you're on estrogen therapy, there's a decreased risk of dementia.
I wish
So,
I'd known about this 20 years ago. I'm turning 70 now, and I did nothing for my menopause. I was
yeah.
luckier than my friend who just like would be drenched.
Oh,
I've always had hot flashes all my life. It's just always been one of those things where my body overheats
yeah,
and I need to cool it down. And that's just being who I am. But I took nothing. I was very on an awful lot of nutrients. So I was
yes.
taking a great deal of nutrients at the time, probably more than I am now. That may have something to do with it. I would be hot, get a few sweats, but nothing like what some of my friends went to. My period stopped, and then that was it. Waistline definitely gone, definitely. But
Insulting.
but it was at that time, 20 years ago, no, people were taking this estrogen thing for
Mhm.
menopause, and all I was hearing side effects.
Oh,
Right. So it was like, no, I'm just going to do this the all natural way and just make sure that I'm giving my body as much nutrition as it needs to keep it balanced and optimized. But I
yeah.
I knew nothing of this. And I can guarantee any of my friends in my age bracket, we knew nothing of this at all
And
because
I
there
would
was no
say
one to ask.
most people don't
No.
know. We're just finally, I think my generation, I hit menopause and Oprah hit menopause, right?
Yeah.
And so when a powerful woman hits
Yes.
this, and you're like, what how come no one has addressed this? And I will dare to speak up.
Yes.
And I'm sorry that it takes a celebrity to speak up. And I hope that we as women and those who support us hashtag stop sucking it up. If you have menopause, know that there's the Menopause Society, and there are currently 1,300 Menopause Society certified practitioners, but a whole bunch of people just took the test and are taking the test this month. So that number may double, triple, I don't know.
Yeah.
And then there's another set of us taking it in like September, October. I missed the deadline for June, and we'll be taking it then. But Pandia Health, we happen to pick up 2 of the 1,300 Menopause Society certified practitioners in the US and Canada, only 1,300. And ours are OB-GYNs. Ours have 20 plus years experience.
Mm.
They're leading our 100% physician team. And Pandia Health, we can prescribe in 16 states and we can deliver to all 50. And we encourage birth control and menopause tourism. So if you
Yeah.
can get to one of our 16 states and be like, oh, I'm in New York, California, Florida, Texas, Nevada, Pennsylvania, looking at Illinois, Michigan, Nevada, New York, Oregon, Ohio, and I'm currently in that state, then our doctor can write you a prescription and then we can ship it to all 50 states. Or, get care in your area and check it out on menopause.org, I believe is the website for the
You
menopause.
also talked about telemedicine.
I'm sorry,
The te
telemedicine.
Yeah,
So the
telemedicine. So
telemedicine, all of our services are asynchronous telemedicine. And so the good news is you don't have to make an appointment. You don't need a video. You don't need a phone. You just answer the questions. For menopause, we would like a mammogram and colonoscopy just to make our doctors feel comfortable. If you don't have one, we'll often write a 6-month prescription, but we want you to go get your checkups that you're supposed to have gotten during that time to make sure we're not exacerbating anything with systemic estrogen or progesterone. And it's asynchronous. A lot of people like that because, particularly with the birth control stuff, they've shown people are actually more honest on a questionnaire.
mhm.
When was your last period? How many partners have you had? Are you sure you didn't use any birth control? That kind of
Yeah.
thing. Versus a video or phone where they may feel judgment.
Yes, yes.
And we have a HIPAA compliant website where you can direct message the physician back and forth if there's any questions between you and the physician to clarify before and after writing the prescription.
Excellent. I mean, such support. It's wonderful. I'm so glad you're doing this. I hope that somebody does pick up the franchise here in Canada because it's so needed. There's just not enough conversation on it. And we
Yeah.
recently had Dr. Paula um, Gates on dense breasts, which I
Uh,
never even knew anything about, right? So,
uh,
there's so much about our body we don't know, and we don't know the options. Yet we're living with this body. And I feel
yeah.
there's so much that could be preventative that, and instead of waiting until we get a problem and then looking for the right doctor, the more empowered we are in knowing what we can do,
Yes.
to support our own body. So to not get pregnant, to choose not to have a period, or to see ourselves through menopause properly, that is our own empowerment. It's our choice of looking after ourselves. So this is why this particular show is called Your Health is Your Choice. The more you know, the more you can look after yourself, which is important. And I hope that whether, people are listening to this in anywhere else in the world, that they go to your site to find out more there, so they can go back to their doctors more educated and go,
Yes.
how about this and how about that? And
Yes.
okay, you don't know what you're talking about. Okay, go to Pandia Health. They'll educate you, right? Because that's
Exactly.
if they watch what you're doing, maybe it's something that they pay more attention to and helping their patients. Because I feel that, never mind suck it up. I also feel we've been brushed under the rug. Oh, it's
Yes.
just a natural thing. A woman has a period, she gets pregnant, there's menopause. It's just a natural thing. And it's like, you don't know what we go through,
Yes.
right? And so why should we have to go through it in a way that is uncomfortable or painful or
Mhm.
distressing when
Mhm.
we don't have to?
Yes, yes. And that is, a huge point of hashtag periods optional is realizing the number one cause of missed school and work under the age of
Mm,
25 in a person with a uterus is painful, heavy periods.
yes,
And a lot of women are like, oh, well, my auntie had it, my mama had it,
yes.
my grandma had it. It's just a yen thing. Well, my parents were blind, but we get glasses. And I have allergies and I take my allergy meds. People have asthma and they take their medications.
Mhm.
People have diabetes, they take their medications. So if you have bad, evil periods or you're missing work or school, please see a doctor.
Yes,
Please consider hashtag periods optional and know that you don't have to bleed every month if you're on the birth control pill patch ring. You just skip that last week and just go straight to the next month. Though on the patch, you only can do that for 12 weeks in a row because the estrogen builds up. But on the pill and the ring, you can go infinitely. I didn't have a period for the past 14 years since my last child because I just continuously took my birth control pill. And only if I forgot for 2 or 3 days, then I would have a withdrawal bleed. And then for menopause, I just switched right over. For those that are in perimenopause, approaching menopause, and your periods are getting a little weird, know that you could go on the birth control pill to make hashtag periods optional. And then around 52, we just take you off and we're like, are you there yet?
hmm
Or you test some blood tests and switch over to menopause replacement therapy rather than what people again don't talk about. And this is our opportunity to talk about it is that to me, heading into menopause is like running out of gas. You
mm.
can go put, 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 or you can go bleh. And no one talks about flooding. And I
Mm,
spoke to women, I was like, so flooding just happens once, right? And this colleague of mine is like, no, there was an entire month that I could not visit any friends for fear of flooding and ruining their furniture.
yeah,
And I was like, what? If this happened to me once, I would immediately turn everything off so
yeah,
that you don't have to worry for an entire month that
yeah,
you might bleed out like stink. How crazy is that? And so
yes,
I really do believe those that go into menopause on the birth control pill patch, ring, implant, any hormonal thing will do better because you're already on hormone replacement therapy. And then you actually don't know. That's the hard part because I haven't had a period for 14 years. I don't know if I got into menopause except for
right.
these changes that I saw and then blood tests that you can check. And then you just switch over to the hormone replacement therapy and use some backup birth control just in case because we don't want an unplanned pregnancy at 52.
Right. We don't want you having it at 15, and we don't want you having it at 52, not unless it's your choice.
Yes.
And quite honestly, at 15, you're not really ready to make that choice anyway. So, we need that preventative. We need that keeping our body in check. I know that my daughter, my 41-year-old daughter, who's not going to have children, would love to not have her periods. Right.
Yes.
So, she travels a
Please
lot, she works a lot.
have her watch my TEDx talk. And if she
Yes.
hasn't considered the implant or the IUD, that 30% of the time, no periods, 70% continue to have periods, but lighter, and it just varies on the individual.
Right. Yeah, and I will add that TED Talks to your show page. But also, let's just talk about too that you're also in the Mission Accepted 262, which is delighted to have you in here. And that the show, as I've interviewed so many people from the book, will be found along with all of the other platforms as well. So you're going to be everywhere. Actually, tomorrow is the kind of the physical book launch where we're going to meet everybody and everyone sign, which unfortunately you're not going to be there, right? So,
Um,
but I'm looking forward to actually meeting people that I've interviewed, which is great. But I mean, the concept of this book, the reason why I had you on, because I heard you talk on the summit. And it's like you're talking about subjects that we just don't talk about and that we need to talk about. And that is so important. And I'm glad that even in the book, you address this and it's that that door opener, that crack opener to like, what are you saying? Is something I didn't know. There's something I don't have to go through this and I don't have to go through that. And this is the whole thing about doing shows like this is that letting people know what's going on so they can ask the right questions or they can reach out to you if they're in America, but know more about their own body and what the empowerment of making a choice for their own body, which, under the current system, we just feel that, oh, well, the doctor said. But, did the doctor really understand what you're going through? Oh, I've just got to suck it up. It is what it is. It's part of being a woman. No, we are incredible women and we're doing more today than we've ever done in the
mhm,
history of time. And we're breaking boundaries. We are just absolutely, the ceiling has no roof. And we don't need things like periods getting in the way or unwanted pregnancies or menopause slowing us down because
no,
there's so many people in my generation 50, 60, 70. My oldest person I've interviewed was 92 and she's still going. She took a lover at 90, right?
yeah,
So, it's not over until it's over. We
yes,
want more oomph. We've got things to do. We've stepped into our passion calling now, and we don't want things like the menopause or the estrogen or the osteoporosis or anything else getting in our way. And yet
yes,
we're not educated on it at all. So thank you for being, putting Panda Health out there, for educating people, for making it accessible, for making it affordable, for backing people up. I pray to God you could get into the school system. I think if you can get into one school system, they see the success of it, it'll become a curriculum, but it
yeah,
needs to be taught with sex ed. Right,
yes,
so people understand, and even guys, you can pay attention to what a woman goes through and what her
yes.
options are. Why do you have to leave the room? Right,
Yeah.
if you're wanting to
If you
have
want to be a
fun,
physician, you're going
yeah,
to have to know, but also
yes,
the educated human being, right?
exactly. And
You're
also,
going to
if
have
you're
a
wanting to
daughter.
have, yeah, if you're wanting to have sex with someone, you've got to know what it entails, and that if you're not going to use the rubber, is she on the pill? And
Yes,
because we don't teach them because it's no, it isn't. And take religion out of it,
yes.
out
It's just
of it.
science. It's just
Yes,
science. And
this
that's
is
the
the
way,
mechanics of our body. Leave it
yes.
alone.
These are your hormones. This is what happens when this happens. These are the
Yeah.
options out there. And
Yes.
know that 70% of people using the birth control pill patching are using it for non-contraceptive benefits.
Mhm.
As I mentioned, hashtag periods optional, acne, but polycystic ovarian syndrome, endometriosis. And so we cannot make birth control illegal as they are trying to make in the United States because simply we shouldn't because of birth control. But if at the very least, there's 70% that are using it as well for non birth control reasons. And
Yeah.
there
No,
shouldn't be
no. It should be complete. This is not a political talk.
yes,
Our
yes,
bodies is not a political arena.
yes.
So no. You suck that up, not us. Right, completely.
Exactly. My body, my choice, your body, your choice. If
Yes,
you don't want to take the birth control pill, that's your choice.
right.
Don't take it
Exactly.
away from me.
No, you have no right. You cannot talk about what goes on in our body. No. And, we need to empower women to know that nobody can tell them what to do with their body. What you are offering them is that solution in life, not only physically, to prevent or to help through periods or help through menopause, but especially for those young people that on social media feel they need to go out and have sex early, right? And they're not ready, but it's kind of the cool thing. Then let's get protection in them. Let's get that protection there, and
Yeah.
let's get them to actually. And this is why I think in the sex education in schools, in community centers, Eric, the boys need to be there. They need to
Yes.
know what girls go through. Yes, get uncomfortable. We're going
Yes.
through it. I'm sorry if you're uncomfortable, get uncomfortable. But also
Yes.
know what happens to a girl's body when she's actually pregnant. Never
Yes.
mind what we go through for 9 months and then the birthing and then the 50 years of raising, right? You need to understand your consequences as well. So I think this needs to be in there and the people need to know. And
Yes.
so thank you for doing what you're doing. I hope you expand even further. I hope that other countries pick it up because you've got a wonderful template there that they could utilize in their own countries. It's wonderful and great for doing what you're doing because it's really, really important. I wish I'd known when I was younger. I wish my children had known that I'd been able to tell them, but I don't know what to tell them because no one was talking about it. I can only talk from my experience, right?
Yes.
And that was it.
Yeah, no, it's up to the, education community, the physician community, the health community to do that education. It shouldn't be up to the individual parent because they aren't physicians. They
No.
haven't gone to medical school. They don't know the drugs. They don't necessarily know the physiology. So it's up to the health educators, the school system, and physicians. And just, please follow us on social. Pandia is Pandia. The way to remember it is Pan is every. Dia is day. We want
Uh-huh.
to be with you every day. It's
Mm.
also the Greek goddess of healing, light, full moon. But I made up that definition because people like panda health, and I was like, no, Pandia health every day.
Right.
Pandia health on Insta, TikTok, LinkedIn, YouTube, Facebook, you name it. But we have a lot of great content on our website, on YouTube, on Insta, on TikTok, and all of those we monitor. So if you have any questions, you can throw them down and we'll either answer them there or we'll answer them in a future TikTok live or
Mm.
Instagram live. I think TikTok live once a month. So if you catch me, then you can ask me questions then. And
Excellent. So it's pandiahealth.com and you
yes,
can put Pandia Health slash menopause. Can you also put period Pandia period as well or
and
just
pandiahealth.com/periods optional, or
right?
just Google Pandia Health birth control, Pandia Health. But if you just go pandiahealth.com/menopause, I know you'll get to the menopause page. But if you just go to our main page, we have click on this for birth control, click on this for acne, click on this for menopause.
Mm.
But the periods optional page is pandiahealth.com/periods optional, and it'll direct you to a talk, and you can reference that for your physicians and be like,
Mm.
Dr. Yen, and you can see my credentials there, says this. And then for menopause, I recommend a couple of books. One is Estrogen Matters, and that is written by an oncologist who discusses the Women's Health Initiative and all the negatives, what they did wrong and the limitations of that study, and then goes over the new literature showing that estrogen is safe, does not cause breast cancer, and it's actually the synthetic progesterone that puts you at risk for the breast
Mm.
cancer. And then two menopause books I love is the Menopause Manifesto, and then the other one is The New Menopause by Dr. Haver. Love her, and she talks about nutrition, which to me is pretty much Mediterranean diet. But then she also
Yes.
talks about weight bearing exercises. So many of us are focused on aerobic to lose weight, but she's actually about building muscle for the bone safety. So
Yeah.
that's the
Well, I
new.
had no estrogen for my menopause. I'm not taking anything now, and I have compromised body. So, folks, you do not want to end up like me. So please go and do your preventative, go and do what you need to do. And the stitch in time saves nine. So the
Yeah.
more you know and the more you prevent, not only can it help you for what you're going through in the current time, but you're also helping what you are going to go through in the future, right? So your health is your choice, folks, and Pandia Health is here to help you go through the menopause, go through the period, go through the baby prevention, because some people don't want kids and some people only want one or two, but we enjoy sex. So we don't want to have just have sex twice in our life to produce. And we also don't want to see, 22 kids per family. Because the world is not equipped for that either. So let's look at the preventatives. Let's look at the preventative of the uncomfortableness of the period. Let's look at the support of the body as it goes through menopause, and also decreasing some extremes that some people go through. And don't forget, to pick up the Mission Accepted 262 women book and read her chapter in there as well, because this lady has got a lot to say, and I want to get right behind her in her saying that I want this in schools, I want this in community centers, I want mothers forming a mothers group and talking to their children, maybe when they're around 9 or 10 and are receptive, not when they're teenagers and we don't know anything, right? And I want, women to start talking about this, share this podcast, have a podcast party. And then what you didn't know, what you're going to need to know for your children, what you didn't know about menopause, and start talking, right? Start talking, start sharing, start getting this information out there, because we want your health to be optimized right to the end. So thank you so much for sharing here today. That has been wonderful. Thank you.
Thank you.
Until next time, folks, bye for now. We hope that you enjoyed the show. There are so many more for you here on selfdiscoverywisdom.com. Just go to the podcast tab at the top there and you will see all the many genres and all 3,000 shows ready for your listening. We are here to serve you, to help you on your journey of life, and we know that through inspiration it begets invitation. We are supported by you, the listeners, and those that we interview. Anything that you can spare us in donation would be greatly accepted, and we do hope that you enjoy the next show.